Hey, everybody, welcome to week four. We got a few topics this week. We'll talk about organization of care. We'll look at the overall healthcare workforce, and then talk a little bit about how we, lead, manage, govern healthcare organizations. I think it's important to start with looking at, kind of the continuum of care, if you will, and all the different places that us as patients can seek care. And this is one way where we have evolved quite a bit in the right direction. I feel you feel free to disagree with me on that, but nowadays we're seeing more and more prevalence of urgent care facilities, even in places like the grocery store I go to. One of the large hospital systems actually has a pop-up right there in the front of the grocery store that I've utilized before for things like sinus infection, flu. Real easy to get into, get out of. There's a pharmacy as part of the grocery store, so easy to do. Many of our drugstore chains, your CVS's, your Walgreens, your Rite Aids, they've started adding those services as well, and have really started to shift their focus to playing a major role in healthcare. I know where I live, if you go to a CVS, more and more of the retail space is being taken up with healthcare products. I was surprised a couple years ago. I went in there, hadn't been in quite a while, and noticed that there's a pretty large section of things like wheelchairs and walkers and crutches and canes, mobility aids, for shower stools, bathroom seats, that sort of thing. That frankly, we didn't used to see in those places. So we're seeing more places to get care outside of the traditional doctor's office. Because if you look at the traditional model, if I get sick unexpectedly to the point where I need medical care, prior to all of these ambulatory places, if you will, I call my doctor's office, and if they can't see me that day or in a reasonable time frame, where do I go to get care? Well, in most cases, it was if I was serious enough, I'd have to go to the emergency room. Where's the most expensive place to get care? That is the emergency room. What further compounds this is, where's the one place that cannot deny you care based on your ability to pay? Also, the emergency room. So, if I can't get health care, the one place I can go, even if I can't afford to pay for it, is the emergency room. So that gets us into this, pretty bad cycle of, running healthcare costs up, if you will. So we do a lot of cost shifting. Whereas, if I come in, as an insured patient, they're excited to see me because they know my insurance is going to likely cover a good deal of this. So I think if we also look to the future, what does the healthcare of tomorrow look like? Well, the one thing that, studies have shown, regardless of my income level, that almost everybody has is this, right? A cell phone. And, we've become more tuned in to certain aspects of our care via the cell phone, through a number of reasons, right? I can communicate with my provider that way. I can see elements of my medical record on my cell phone. I mean, then the other angle is a lot of us are doing this, right? We're wearing these personal health devices that can track for me. Okay, so a little device on my wrist can tell me how many steps I took a day. It can tell me how well I slept last night. It will tell me what my resting heart rate is. What my peak heart rate is. And this does kind of give us some more of those, micro levels of data instantaneously, right? I can go for a run, look at my fitness tracker, and see how many calories I burned. Okay, I kind of use that as a justification to figure out, okay, well, can I have that dessert now because I went and exercised? Okay, so we talk about consumer-driven medicine, where as the consumer, I'm empowered more because I have access to more information. That's good and bad, right? We've all, probably made the joke about consulting WebMD for things. The last time I had to go to the doctor for some minor ailment, I've known my doctor for a long time, and he comes in. He said, "What's going on?" I said, "Well, I don't know. Here's my symptoms." I punched him into Google and looked on WebMD, and my funeral is tomorrow because it's clearly severe. Since I know nothing about actually how to treat my own conditions, but I have access to this treasure trove of information. So could start to be a little bit of a problem as we lean on those resources a little bit more. So those are some of our key topics for this week. So look forward to your discussions.